Hi, thanks for joining us. You're watching Health Matters. I'm Renee Rouse with the Florida Department of Health in Martin County. Our mission for this show is to give you important and urgent information that affects the health and safety of you and your family. Fish is an important part of our diet. They are high in nutrients that most people don't get enough of, like omega-3 fatty acids and vitamin D. But for all the good that they can do, certain fish may contain high levels of mercury, an element that is certainly not healthy for your body. As a matter of fact, a 2010 study found that 25% of women in Martin County had higher than normal levels of the toxic metal in their systems. In this episode's big story, we look at a study underway to determine if outreach efforts over the last few years have helped lower these dangerous levels of mercury in our community. It can be said that having some degree of fish in your diet is a good idea, but one thing we know for sure we shouldn't be eating is processed foods. We are all guilty of eating fast food for a quick fix or a bag of chips as a tasty snack, but many types of these processed foods contain high levels of sugars, artificial ingredients, and are low in nutrients, offering no health benefits and actually making us sick. In our Health Spotlight segment, we head to downtown Stuart, where one company is creating a whole new market around getting those processed foods out of our diet and serving up the freshest, locally sourced food from their own backyard. We take a trip to the urban farm and experimental kitchen workshop, Ground Floor Farm. And finally, you've all seen them, and many of you probably have them. Be it an iWatch, a Fitbit, or any number of wrist-worn activity trackers, the small computers that often look like a watch or a bracelet have become a popular accessory. People wearing them to work and wearing them to bed, all in an effort to help them live a healthier, active lifestyle. One city has actually incorporated Fitbits into their health and wellness plans for their employees. We visit with leaders at the city of Stuart to show us how they are helping change people's perspective toward exercise using the digital activity trackers in their Working on Wellness program. But first, living so close to the water certainly has its advantages. One of those being an endless supply of fresh seafood restaurants and markets. But it might be a good idea to eat that tasty tuna in moderation. Previous studies have shown that women sampled in Martin County have elevated levels of mercury attributed to eating fish with high levels of the element. Now, after several years of outreach and education, health department employees want to retest women in the area to see if levels have gone down. We head to the Martin County Clerk of Court's office, where they are participating in the study.
It's from the occipital region of your scalp, which is kind of right in here.
Mm-hmm. Katie Eckhart is getting her hair cut.
It's 100 strands, which is about the diameter of a pencil here.
But not in the way you might think.
And I had recently heard about it one morning on the news, that there was a spike in mercury, or that some women might have high mercury and they don't know.
Katie is participating in a follow-up study to determine mercury levels linked to fish consumption. Her father, who was a science teacher, had previously warned her to be careful about what fish she ate because of the potential health risks.
And he was actually the one that told me, yeah, and women are actually already higher in mercury, usually anyway. And so I knew a little bit.
A 2010 study done by the Florida Department of Health sampled 4 Florida counties. Results showed that of the women sampled in Martin County, 25% had elevated levels of mercury. The Martin County levels were higher than the other counties sampled and higher than the national average.
Mercury is something that accumulates in the environment naturally.
The metal is also released into the air through pollution and waste, says Todd Reinhold with the Florida Department of Health in Martin County.
When it settles out, it can get into the environment, and microorganisms can break down the mercury into methylmercury.
And that is a concern. Methylmercury can accumulate in streams and oceans. It can taint the food chain as each fish absorbs those toxic minerals. The bigger and older the fish, the more likely it is to contain more mercury. Some of the fish with the highest levels of mercury include shark, tuna, marlin, king mackerel, Chilean sea bass, and swordfish.
When we eat those type of fish that are high in mercury, then we can also accumulate levels of mercury in our bodies.
And that's bad. Anyone can be harmed by methylmercury. However, the risk is highest for women of childbearing age because mercury can damage the nervous systems of developing fetuses. Children younger than 6 can also suffer health consequences if they're exposed to too much of the mineral.
When I was pregnant with my 2 sons, the doctors definitely warned me about high mercury affecting my unborn child. But other than that, no, it was never a major concern.
April Watson is also getting tested. She admits her love for seafood, but is careful about eating too much.
I'm constantly thinking about, especially with myself and my children, making sure that we're not eating too much of any one thing that's going to be harmful, but in moderation.
And Todd says that's exactly the message he wants to send out.
Even though fish may have mercury, doesn't mean you can't eat those fish. You just have to be aware and make healthy choices and have a variety in your diet with fish.
Now, the health department study is not yet complete, so if you would like to be tested for free, it's very simple. You must be a woman between the ages of 18 and 49 who has lived in Martin County for at least 1 year. Participants simply fill out a short survey and provide a hair sample. Test results are mailed to the recipient in 4 to 6 weeks. If you'd like to learn more or schedule the free test, call the Environmental Health Office at 772-221-4090. Eating healthy can be hard to do. It's often more expensive to find and buy fresh organic food. And in our busy lives, it's sometimes easier to run through the drive-thru than to sit down and make a healthy home-cooked meal. Ground Floor Farm is trying to change all of that. Bob Hoganson had a chance to tour the robust vegetable garden and working farm in downtown Stuart, where the distance from farm to table is literally just a few feet.
Most days, somewhere along these rows of vegetables and tomato vines, you'll find farmer Mike Meyer getting his hands dirty.
Farming is a really wonderful lifestyle.
His love of farming brought him to this small piece of land in the urban center of Stuart.
We all came from the food movement where, it was a given that you shopped at the farmer's market and that you ate, organically and local and seasonally.
He says that movement to eat local, fresh, and organic hasn't quite caught on here yet, but he's trying to change that.
And so instead of just being another zealot and saying, if you don't eat organic, if you don't eat kale, you're a bad person, or if you don't compost, you're, not cool. We thought, okay, how can we get as many people interested in this and move our culture forward towards more sustainability? And so make it accessible, make it fun, make it delicious and easy.
That's where the idea of Ground Floor Farm came from. Mike says he wanted to create a space that helps grow a more dynamic community through food, art, and fun.
Under the row cover, we have our baby mustard mix. This is one of our custom salad mixes that we sell on the farm.
The farm produces dozens of varieties of fruits and vegetables, all of which are sold right here on site. These varied greens you see here will also be used to create the menu that you order from in the attached cafe.
We are trying to introduce people to new and exciting tropical fruits and vegetables, things that you don't really find in the common familiar vegetable section of the grocery store.
Mike says a one-size-fits-all approach to farming doesn't really work here in South Florida. He says that the climate here is so different from the rest of the country that to maximize his crops, he has to think differently.
One thing that we've learned is that sustainability and local food, it's different in different places.
He says knowing what to plant and when to plant it is paramount to a successful farm.
This is our tower garden where we grow, right now we've got kale, head lettuces, and bok choy.
The farm is less than an acre in size, but with the hydroponic tower garden, they're able to produce many times more than what they could by planting in the ground. Also, many of the plant beds are on a quick rotation, allowing the farm to feel bigger than it really is.
I'll plant a bed of salad mix, say, in 3 to 4 weeks I'll harvest it. I'll harvest it one more time, maybe a week later, and then we'll till it under and plant it right again.
And everything here is sustainable.
Each breed of chicken lays maybe a slightly different colored egg.
Take the chickens, for example. They eat the organic leftovers from the kitchen, they lay eggs that the farm sells, and their waste is composted and turned into a nutrient-rich fertilizer that goes back into the garden. But beyond the tasty leafy greens out back and the flavorful cafe up front, the farm aims to educate as well.
We currently have a roster of lots of really interesting and popular classes in the kitchen, especially right now. So baking bread, making cheese from scratch, fermenting vegetables, making sodas and kombucha. So right now that's kind of our main educational focus is in the kitchen.
Mike says the farm demonstrates what food really is and calls himself a sort of performance artist. He just hopes you'll call it delicious and hopes you learn something when you come here.
I don't want to say that we're not doing an important job growing food, but we're making food conspicuous. We're hopefully making people think about it in a different way, and hopefully that will translate to more support of local farms.
Thanks, Bob. It's really important to pay attention to what we eat. Processed foods can be inexpensive and easy, but they can do so much harm to our bodies. And the health benefits to eating fresh are clear. But that's not all you need to do to live healthy. Exercise is an integral component to any wellness program. MCTV's Gabby Ferraro shows us how employees at the City of Stuart are tracking their exercise and having fun while they're doing it.
It's kind of depressing if you can't make a certain amount of steps. It means you've been a slug.
Sergeant Heather Roth has been anything but a slug over the course of her 22-year career with the Stuart Police Department. She was on the front lines of public safety for years, but her job description has changed over time.
When I first started working, my weight was a certain weight, but as I aged, my weight has gone up.
Instead of chasing bad guys on the street, she now largely has a desk job. It wasn't until the city started issuing Fitbits to their employees as part of a new wellness program a few years ago that Sergeant Roth took note of her health.
Oh, I thought I was doing great. I thought I was moving a lot. I thought I was active.
But no, she wasn't. After wearing the fitness tracker that links to an app on her phone, she realized she had work to do if she wanted to lose weight and stay healthy.
I don't want to have a day go by that I don't meet my goal.
She has since upgraded to an iWatch that reminds her to get up and move if she's been sitting too long. It also keeps track of all her movement and exercise. She can set step goals to reach for each day, and she pays close attention.
When I get home, I can look at my activity, and if my steps are not where they need to be, if I haven't reached my goal, I grab my two daughters, who's 15 and 17 years old, and I say, let's go for a walk.
Empowering employees to take control of their lifestyle and promoting healthy living through activity is exactly what the City of Stuart's Working on Wellness program is all about, says Human Resource Director Roz Johnson.
We promote walking meetings, so if you and I are working together and we have a meeting to conduct, let's take it outside and take a walk.
Yeah, it links from my wrist to the through Bluetooth.
All employees are eligible for a Fitbit. They connect to a citywide portal where goals are set and gift cards can be won during different competitions. The technology and incentives are paid for by the city's health insurance company.
So if we can keep people out of doctors' offices and out of the hospitals for surgery and find other ways, alternative methods to improve health, that's the ultimate goal.
Roz says that since the program started 5 years ago, the city has saved over $1 million in health insurance costs and earned the prestigious Healthy Champion Award from the Florida Department of Health.
So I think that these tools can be really beneficial in helping people to become more physically active.
Mary Beth Pena, a nurse program specialist with the Florida Department of Health in Martin County, says that people with desk jobs need to especially pay attention to their activity, as studies have shown that sitting for prolonged periods of time can adversely affect your health in many ways.
And in a world where many of us are sedentary for much of the day, it's really important that we have some kind of tool to motivate us to get up, to get to the next office instead of calling the person.
She says most people should be getting 10,000 steps a day, and a fitness tracker can help you do just that.
This is today. This is steps, that's exercise, that's standing.
For Sergeant Roth, the wrist-worn computer has changed the way her whole family interacts.
To me, it's important because I need to show my girls that you need to be self-conscious of your movement, because it's so easy for teenagers to sit on a couch and look at their phones. But if they see that mom's caring about how much she's moving, and also it gets them away from the phone.
Thank you, Gabby. Those gadgets are certainly useful and fun to use. Now on to our final story. Eating right and getting exercise are important factors in your health and well-being. But for children, there is a major health issue that is often overlooked. Healthy teeth are important to your child's overall health. And children with poor dental health can have pain and infections that can affect their performance in school. According to the American Academy of Pediatrics, tooth decay is the most common chronic children's disease in this country. To help protect the children of Martin County and address the need for more oral education and support, the Florida Department of Health in Martin County just unveiled this newly wrapped van. Its goal is to help promote the school-based dental sealant program and raise awareness about the importance of public health. Staffed with a dental hygienist and administrative assistant, the van is in motion each week, providing services at area schools and daycare centers. With parental permission, the hygienist meets with students individually, providing an oral exam and tips for keeping teeth and gums healthy. If the teeth are in good condition, the hygienist applies a protective sealant to prevent cavities. Each child is also awarded a new toothbrush, toothpaste, and dental floss. Joining me on set today is dental hygienist Millie Ruiz and Carol Ann Wegner, Director of Nursing. The health department has screened over 3,000 children since the program began in late 2014. Welcome, ladies.
Hello.
Well, first I have to say, for those who may not know, Millie was recently recognized as an oral health champion, a rural health champion by the LORN, which is the Lake Okeechobee Rural Health Network, just very recently, for your work in the community, and you do such excellent work in the community. Welcome. So this program is relatively new. Tell us a little bit, Carol, how it got started here in Martin County.
Well, back in October of 2014, the state was granted funds, and we were selected as one of the pilot counties to provide the school-based dental sealant program.
Excellent. And this requires funding, obviously. And
yes.
Can you tell us a little bit about how that program, or how this program is funded?
Yes, we were very fortunate to have Children's Services Council. It's a local organization that is funding our full-time dental hygienist and our staff assistant.
Excellent, excellent. So Millie, what would you say is the most important aspect of this program?
I think the most important aspect of the program is that I get to have the child one-to-one, personalize the instructions. Generally what I see is where they're missing. I'll show them with a mirror where they can improve in their home care. Show them if they have any cavities, what it actually is. Generally, they look pretty good. Generally, we have some children who have cavities that are not aware of it. I'll explain what a cavity is. I have a model, tell them what goes on, and if they're not hurting, telling them the importance of getting that filled. And also we have the children that have urgent needs where you see infection, cavities in all 4 quadrants. And I also explain to the child why that is so important, because it does matter in their health and how they're feeling, and I'll ask them a few questions if they're in pain, and I'll explain why they are in pain, and also follow up with the parents.
Right, and that's really important. And I've seen you working too when the parents are present, especially for the younger kids, helping the parents understand, you know, how to help their children brush better and what they need to do to improve their oral health, because it really does affect their health from now until their whole lives, really. The other thing that I think is important is that the need for the follow-up care. If the kids' teeth are in great shape, wonderful, but sometimes you do run across situations where the children really need some urgent care, and that really has led to the formation of a dental coalition. Can we talk a little bit about that?
Well, our dental coalition is comprised of a number of community partners from various organizations, and we have about 10 members at this point, and we meet on, I would say, every 2 months to discuss the needs of what Millie has found in the children, and we brainstorm and look for ways to provide those services in the community.
Right. It's important because you know, the work doesn't end. You know, you're continuously out in the daycare centers, in the schools, meeting with the children, and you know, oftentimes the parents do have difficulty getting that connectivity to care. So it's awesome that, you know, the coalition is underway and these kids are being taken care of. That's terrific. How do parents and children get connected to the program? How does that work?
It's through, first of all, we have the little cards that promote the program, and there is a consent form that is sent home, and that's how they connect. If they have parental consent, that's how the child, when I'm at the school, is being seen. And from there, we follow up depending on what the child's needs are.
So it's as simple as parents saying, yes, it's okay for you to check my child's teeth. The consent comes home, the parent sends it back. They're scheduled at the school so the kids do not miss time. Parents do not miss time taking time out of work. The kids are seen right at school, couple of minutes, and then they're back to class.
Exactly.
And it's all free.
To all of the Martin County children.
Free to all children, regardless of income.
Exactly.
Excellent. What could be better than that?
Exactly.
Ladies, thanks so much for joining me.
You're welcome.
Thanks for having us.
Well, that wraps up today's show. I'd like to thank the Martin County Clerk of Courts for taking part in the study. I'd also like to thank the City of Stuart for sharing their wonderful Working on Wellness program with us. And thank you to Ground Floor Farm for all the work that they do to promote healthy eating in Martin County. And finally, thank you Carol Ann Wegner and Millie Ruiz for joining me on set today to share in the wonderful things the State Department of Health is doing to keep children in school and healthy. Thank you for joining us. I'm Renee Rouse, and remember, your health matters.